Our people we did live right from Lagos, from Abuja International Airport, where the COVID-19 vaccines they arrived for the first time in Nigeria. This don't be news where they work up and down all the while. Say Nigeria go follow for countries where go receive the AstraZeneca vaccine, where they go use vaccinate people sake of COVID-19. Today, the formal arrival of the vaccine, and this flight where they see now, the flight where carry the vaccine, they arrive the country, and as they talk now, the flight do arrive, and in a little while they go begin they release the vaccines from the vehicle. Thank you. Thank you. Phone I go the jump front. Thank you. Over there. Let's respect ourselves. So these people with the airport workers don't gather around the vehicle. They are working on it to help make sure say they release the vaccine from that aircraft before government go keep and where they go begin the distribution to states for the forward vaccination of Nigeria. Nigerian government they plan say they will vaccinate approximately 16 million Nigerians, will be about 70% of people where they qualified to receive vaccine, where don't grow rich to receive vaccine for the country. But for now, then they receive the first set of the vaccines where they arrive. This morning we don't do around the airport. Since morning they wait, make it arrive, and as they talk to you, the vaccines don't touch ground. The Coco be say the total vaccines we supposed to inside this flight now about 3.92 million vaccines, million doses of AstraZeneca COVID-19 vaccines, where they come from the COVAX facility, where be facility where they use the so the COVAX facility in there then suppose then from they bring all these vaccines now COVAX facility and for program where they set up to use help third world countries where no too who to vaccinate their people against COVID-19. We hear say the vaccines they coming from India into Abuja. So we did here live to show now waiting is they like how the thing will be like. I make a fool all over this place. So however they go here, we did here live with you now. Emirates aircraft now carry vaccines coming in a little while. They will begin to bring them out from inside the aircraft. This particular crane where they see so now him they go near the aircraft to go bring out these particular vaccines. Over 3 million doses of vaccines now he's supposed to be inside this particular aircraft. So I'm gonna follow us as they bring in an update as it happen, whether to the vaccine go inside the plane or not. You could on the lookout. And for now, when they talk about the vaccine, if you're ready for the vaccine, time don't reach for you to enter our comment section to talk. Say yes, you ready to receive the vaccine or you're not ready.
Absalam. Can you go this way? No, Ty can see it. Ty can be a fish. All this one thing is supposed to follow us.
Mama, I just small now. See space.
They move, we slow the suffering. All your you don't change that.
Much than to what? The
time we move, you know, this one you can record.
Boss, we're recording live. See. The government delegation don't they arrive? Where they go receive the vaccine?
Okay, sir, please. Let's get shot. Thank you. No problem.
We've already there and the government government delegation, including the Minister of Health, allowed to be here to receive the vaccine.
This Emirates. I've changed it to 5 years. I have changed it. Go and change
Why are they going closer now? Why are they going closer? Why did they move forward?
When the machine is coming, it can spoil your equipment.
Sir. It seems there's a second flight. Emirates also. With what I am seeing, it seems another Emirates air flight they touch down to, and they be like that one to carry the vaccine to they come into, because the first one Emirates and another one they come. So will they touch like that one? See, I'm they far away, they come in, so will they say that one to carry some of the vaccine. They come so they too. Did you come with any green jacket? No. Did you come with any green jacket? No. Sure.
Don't worry.
Easy. Wait, easy.
I don't like it.
Take it. This line, please don't cross this line.
People what they see here, the Minister of Information. I would also see the Minister of Health. All of us. The first set of vaccine.
You are blocking us now. Stay behind. You are blocking us now. See the picture now. This line. You are doing your work. He's doing his work.
Boss, sir.
Don't find this line.
Yes, sir.
Please go back.
Not even since they come down.
Behind the line. Go behind the line, please. Go behind the line, please. Go behind the line. Please go behind the line. Please. Be
Eh? Say?
Mama, easy, oh, easy.
I'm okay. Razak don't come. We don't call her. Check if they on. I don't have.
Behind the line.
Yes,
Please leave the place now. If you need coverage, you go tell us now. Can you come with me? Because you're entering my friend.
Oh, me, I'll be here. These guys are just pushing me. Can we move this?
Madam,
Yeah, there's nothing like that.
Hey, leave the front now. Leave the front of the camera.
Hold on.
They have to help me with the cable so I can move. They are mounting me. I have to move.
You have to take it easy, otherwise you fall
I
something.
have to move, but the cable is not there. I can't move.
But you can lift your camera and zoom in.
Oh, please, gentlemen, now we're not here for that.
It's okay, please, easy.
Officially, the COVID-19 vaccine, the AstraZeneca vaccine, don't arrive in Nigeria. This is not a vaccine, so and then with this, mostly they come out from inside the flight too. And the Minister of Health, Minister of Information, members of the Petroleum Task Force, Federal Government Task Force on COVID-19, they're here too also.
Okay, go on.
Don't mind them.
Allow the stick now. Nobody knows what to take. Oh, wow.
What's happening? The one inside.
I want to see it well. I'm not going that side. Please move that side. So you see that before we allow you, don't get to the roof of the house. We know we will do it. But we have to make it work. If we don't allow you, we don't take it. Bring tractor.
Okay, this is not the location where the cargo airport for Abuja, where the COVID-19 vaccine just arrived. Yeah, and as you can see, government officials they grant to receive the vaccine, and this particular train, him carry the first set of the vaccines enter the airport. This one are the flight we carry and come. The Emirates aircraft we carry and come. To be sent from India, the aircraft from coming. Even though with the turmoil we hear within the Minister of Information and Minister of Health, they talk here because too much crowd they here. They try to maintain safe distance, even as they try cover all this stuff. Gradually we'll give you a full update of everything we don't hear, everything we don't see for ground for here.
It's something else, shop. I'm coming. You want something? You can hold on. Emeka, I'm going to hold the camera. Take my tripod.
The second set won't come out now from the aircraft. As then they bring out the other sets from the aircraft, they see the government officials there for my back. They receive the first one, so they don't bring out, and that set is coming as same as they come out from the aircraft. For people where they drop comments, we they see on our comments. We'll go look into our comments later, but for now, what could they view how many packs of these vaccines then they bring into this country? Sorry, what we don't hear before, we say approximately 3.9 million doses now that they bring into the country. So far so good. We don't see about 4 or 5 different packs come out of the aircraft, and more still they come. More still they come out from the aircraft. For now, we can confirm saying that only one aircraft now him carry this stuff enter Nigeria. As they come out from this side, it also come out from the other side also, for the back of the aircraft and for the front. Okay, with the video now. So the second set and that set of it, now they come out through. In a little while, I'll give you a full brief of waiting. They call this vaccine and other information where you need to see, other information where you need to know about this vaccine them For now, they try to manage the intact, even alive, as everything they drop. We know say the government officials they make comments for our back. Okay, so on that side they don't release down there. We'll still listen to the government later, but for now, we still they try this one now. They are both on this side.
You need to stand on one side and leave it out.
So far, so good. It's actually extended.
Come back, I want
No, he was there. You have his number? You want to call? Yeah, he was recording. Let me see.
I don't know what to
More and more of the vaccines still they pull out of the aircraft. For people where they join us, they don't understand what they happen. This is not the first set of COVID-19 vaccines. First set of COVID-19 vaccines where they drop into Nigeria. So Nigeria is the next country where they receive them for Africa after Ghana and Cote d'Ivoire where we received yesterday, a few days ago. They could be saying Nigeria they intend to vaccinate approximately 20 million or 16 million Nigerians, where according to government now about 70% of people were they eligible to take the vaccine for the country. Now them they won't vaccinate, and sake of peace they don't take custody of about 3.9 million doses of the COVID-19 AstraZeneca vaccine. They call them AstraZeneca vaccine. Live here, the thing just arrived at Abuja about some minutes ago, and as we talk, so it's in the ground, and government officials they try receive them from the people we bring them in. As that one they go on more and more, they find you. Down. Now the pack of the vaccine, with that, the whole ball. for one set.
Just give me 5 seconds.
I'm live. I'm recording live. You just came and stood there.
Sorry. Sorry.
So this is all I need.
Doing those stuff are all long. So you listen.
I said all I need. That's all I need. Why? Now you have me get it. I have the
Okay, for people where they join us, we still there here live for Abuja International Airport, the cargo airport of Abuja International Airport, where the first set of the COVID-19 vaccine they arrived for the first time in Nigeria. Nigeria, they become the next country to receive the COVID-19 vaccine after Ghana and Cote d'Ivoire will be received a few days ago. The Kokobi say almost 4 million doses of COVID-19 vaccine he just arrived. Now him be what they see there. Then they call them AstraZeneca vaccine, where they coming from the COVAX facility where authorities put together to help countries where no too hold to help vaccinate their people against COVID-19. So far so good in Nigeria. Lagos State na him be the epicenter of the COVID-19, and the Kokobi say we they expect say when they go to distribute these vaccines, Lagos get some number. They never tell us which numbers they go give all these states especially those who get a larger number of cases of COVID-19. But for now, Nigeria don't receive almost 4 million, 3.9 million doses of the COVID-19 vaccine. Now they bring out from that aircraft where you see here. So we hear Tory from the government of the country. They want try to vaccinate approximately 16 million Nigerians. We cover about 70% of the total people where they are qualified to collect the vaccine for this country. So far, they never vaccinate anybody because the vaccines just arrive, and I don't see some members of the government where they around to receive the vaccine. They did here, the crowd over there, and no one enter their sake of the same COVID-19. Make we not to go contact them until it may happen. But the government people they here full time. They receive the vaccine from the aircraft. We just bring them in. And if you look around this other side, you see so many of the packs of vaccine where they don't bring out. And they down there where you see many of them where they don't bring out from the aircraft. And then this there so, and many more still they come out from inside the aircraft as it be. We never know how the distribution go be when they go begin to distribute them, but for now this is not the first doses waiting they receive, and according to government now in the next 2 years they plan to distribute about 16 million doses of this vaccine to Nigerians to prevent COVID-19. You want to ask some questions about how this particular vaccine will take affect people where get the virus, how you take prevent the virus, how you take the affect one thing or the other. We get plenty to regarding COVID-19, the AstraZeneca vaccine, about the entire vaccines where they create any kind of story where you want to get about COVID-19 and everything about this the vaccine. Then enter our website at bbc.com/pidgin where you will get enough to read about all this is where they talk about the vaccine. We don't see the vehicles where government bring in where go help pack all these vaccines. You can see one of the vehicles just they arrive now. That long vehicle now in they arrive now where government won't use to they pack the vaccines, they clear out. But for now they see they come out from the aircraft. Maybe now after they clearing from the aircraft, now they could come begin they distribute the whole vaccines. So we'll go closer. They watch the process of lifting it out of the aircraft as we still there here. We go one hear more the way government go release with time. We see the Trump will listen to them, but too much crowd around the government dignitaries with they here. We don't see the Minister of the Information, we don't see the Minister of the House, and the chairman of the Presidential Task Force on COVID-19. All of them they here, but we never really listen to them because of the kind crowd all they see around here. Chairman, man uses your position now. So you know they use now. I'm recording. Thank you. Thank you.
But the problem is when they say you need to do it,
I will.
look at this guy that comes up last night. That they break the life, therefore, that I will be expressed now also with confidence. And on this occasion, for witnessing the arrival of the first batch of 3 million, now 2 million doses of AstraZeneca COVID-19 vaccine, which will usher in the beginning of the end of this disease and has crippled the world. And put a lot of countries and people as part of federal government efforts to continuously assure Nigerians of the safety of COVID-19 vaccine and great awareness, enhance trust, and increase vaccine acceptability. We give thanks to National Primary Health Care Development Agency and particularly
Up to 16 million will arrive within the first 2 quarters of 2021, and then we will see after that. But the significant factor now is to get these vaccines to the state level, from state to GA, and into the health workers, the frontline health workers, so that they can be protected, so in turn they can protect the children, the mothers, and the families therein on.
Okay, what would you say to a group of people who are skeptical about taking jabs of this vaccine because of maybe some kind of superstitious beliefs?
Vaccine hesitancy is a normal thing because you're putting an external liquid into your body. But I can assure everybody, my own mother-in-law has taken this vaccine, and that it's safe. It's as safe as we could be. But the issue is we have to do everything we can as individuals and the collective to make our country safe, to make our world safe. Taking this vaccine, wearing our masks, socially distancing and washing our hands are all part and parcel of ensuring that we stay safe, our families stay safe, and we can protect our communities.
For the benefit of my colleagues just joining, your name again, sir?
Peter Hawkins, UNICEF representative in Nigeria.
Thank you very much.
Okay, that person, a UNICEF representative for Nigeria.
wurare da kika sani kasashen wayansu kasashen da mutane su kai wajen da wani abu amma Allah ya rufa mana kuma ga shi yau Allah ya yarda ya sa
My CEO, I'm just honored by the chairman Senate Committee of Health. And the committee is also in How do you feel about the arrival of the
Well, it's a relief because it gives new hope that with this additional tool, the rival vaccine, we can accelerate towards effective control of this pandemic. Of course, we'll have to continue to observe other public health and social measures. But the vaccine is really a powerful tool, and I'm really grateful for all the partners that have contributed to this. I'm proud to have been part of the COVAX facility together with UNICEF, Gavi, and CP, and other donors who contributed to make this arrival possible. It gives hope, it opens a new opportunity. Now we have to work together to make sure that the vaccine reaches the last person that is vulnerable to the disease.
Now, how many doses do we have here today, and basically what is the next step after this? Is that going to be rolled out immediately?
Yes, this is the first arrival. It's about 4 million doses out of the 84 million doses that we are yet to receive from the COVAX facility. And this is just to cover 20% of the population most vulnerable, starting with health workers, people with underlying conditions such as diabetes, hypertension, and others, and the elderly. In addition to that, there will be additional rollout. As you know, the Nigerian government is working both with the COVAX facility and also with the African Vaccine Acquisition Task Force, through which the government is expected to receive additional doses. Toward the end, this country expects to vaccinate about 70% of the population, which is the coverage required to generate herd immunity, which can help facilitate extension of the outbreak.
And what is the role of WHO in all this arrangement today?
Okay, as you know, WHO has been the guide since the start. We've initiated the strategic preparedness and response plan. We devised tools. We helped country adapt those tools. We provided technical support and assist in resource mobilization to get the job done. As you know, WHO, we have a strong field presence. We are present in all the 36 states plus FCT, where currently we've deployed additional workforce to support this vaccination effort, alongside what was going on already in terms of COVID-19 preparedness and response.
Thank you very much.
You're welcome.
Okay. All right. Okay, that was the representative of WHO, World Health Organization. We come around to talk about the number of vaccines where they're going to receive and the number what they want to do next after the whole process of receiving this number of vaccines. You notice that will be only the white pack, and then they come out from the aircraft onto the vaccine level. You notice on that side of black pack will be inside that crate. Maybe that one too, a part of the vaccine drop there. We go carry the vaccines. So they go. That's the truck. Truck where they can't carry the vaccines. Now they see so they come closer and closer to where they pack the vaccines so that it will be vaccines. I've been expecting the truck will be the type where we cooling van. I was saying they see for this one the truck just did open. I'm going to say hi. They are unveiling. So they don't load up the vaccine into the truck. I will see this is so, and the truck will want 5 vaccines come. The no women come and then come close to that side. And make a no fit come to that side.
I'm really excited that finally, almost exactly 1 year to the day since we reported a case of COVID-19, we now have a vaccine that is safe, that is effective, and will be able to protect all Nigerians from COVID-19. Now, we worked so hard to get the vaccine here, but it's even more hard work that begins right after these vaccines have been certified as good enough for Nigerians by NAFDAC. So right after NAFDAC collects samples and certifies that we should use these vaccines, then we'll have to work with the states, local government areas to make sure that all eligible Nigerians get the vaccines.
So 24 hours after now, have we gotten confirmation if the president is going to take the vaccine in the first stage where you said strategic leadership has been targeted? So if yes, when is the president as well as the vice president and other leaders who get the shots on their arm?
There's no shadow of doubt that Mr. President and the vice president will be taking the vaccines. We're trying to schedule that. Potentially this will be Saturday. Once we get confirmation based on their schedules, then we will communicate to all Nigerians so that they will publicly take the vaccines. Now, in our minds and from science, with the guidance from the World Health Organization, we are very sure that these vaccines are safe, and all Nigerians are being called upon to avail themselves of the opportunity to take these vaccines so that they can protect themselves against COVID-19.
All right, there's still some fears of some people that, beyond Abuja and major cities, that the cold chain facilities might not be available in the rural areas. Can you actually, allay those fears of those people and assure them that, wherever you set up a vaccination site, that there will be the right facilities to ensure that the vaccines remain efficacious?
Right. In the last 2 to 3 years, we've been in a close collaboration with our donors and development partners, particularly Gavi, the Alliance for Vaccines and Immunizations. The federal government has put resources on the table, just like Gavi has done, and we've been able to procure enough cold chain equipment that will ensure that every single political ward in Nigeria has the solar direct drive refrigerator which can store these AstraZeneca vaccines within +2 to +8 degrees Celsius. We've been able to install up to 7,000 cold chain equipment, the solar direct drive, in approximately 7,000 political wards. The remaining 2,000 or so political wards currently have their vaccines being installed. So because these vaccines use solar energy, no matter how rural the place is, we believe that we'll be able to keep the vaccines in the right temperatures. So we're really excited about this opportunity.
Congratulations again.
Yeah, thank you.
Thank you so much.
Thanks. When did you say Buhari and the device is taking it?
They are scheduling, they are trying to schedule something.
A weekend. I use the weekend.
Professor Dr. Faisal.
Let's see whether they have the. Okay. Atiku, call the instructor, let them move it to the back. You are done.
The government officials were here don't receive the vaccine down to Nigeria, and they soon pull out from this area while the airport workers were here now they try carry the vaccines, put them inside truck where they carry them come out from the airport. Just before we go conclude this session of broadcast, we'll go still re-echo everything we don't happen here today for everything go end.
How do you feel about this today?
Really, it's an exciting day. You know, this is literally 1 year after the first case in Nigeria. 1 year plus 2 days. So it feels that we've been working so hard for over a year, and now finally we have the most important tool in the world. So I think the most important thing to say is to really thank the COVAX facility, the global community, WHO, Gavi and CEPI that manage the facility, but also all the European countries, the foundations that have supported COVAX. There was a lot of pressure for us to go on our own to do bilateral deals, but the federal government of Nigeria stuck to the arrangement of working with COVAX and the African Union. These are the two mechanisms that we have to get vaccines. So we're very excited today to get our first vaccines. We know that our work lies ahead of us in getting these vaccines into the hands of Nigerians, but as we have always demonstrated, we're always happy to do this work and make sure we get Nigerians vaccinated, which is actually the goal.
And does it mean that with the arrival of these vaccines, life is about going back to normal?
Unfortunately not. You know, we have a country of 200 million people. We've gotten our first 4 million. We have a commitment of 16 from COVAX and another similar amount from the African Union. It takes some time to get this into the hands of people in our big and complex country. So our work is cut out for us. However, having said that, we have to try and hold on to the small wins we've had, the mask, the physical distancing. But the difference now is that the end is in sight. So we can see the light at the end of the tunnel. It gives all of us healthcare workers the hope, inspiration to do more. But to be honest, we need to be patient with ourselves and continue these public health measures for a while.
When are you rolling out, sir?
The rollout will start as soon as possible. Our colleagues in MPHCDA are really understand this business. We've been doing campaigns for many years for yellow fever, for polio. And so our role at NCDC is to support Dr. Faisal Shuaib and his team as they lead the country's rollout of the vaccination efforts.
Sorry, sir, what plans do you have in place with government to educate citizens to increase their apathy? Because at the moment there's a lot of myth and
Yes, I've seen a lot of stories around vaccines roll around, but remember 250 million people around the world have gotten the vaccines, and we're happy to add another 4 million to that from Nigeria. I think, you know, we all have seen, last year we eliminated polio in Nigeria. After many years, we couldn't have done that without the vaccines. Vaccines are one of the most important tools we have in modern medicine, and we're confident that this will bring energy and depth to the response. So we're actually very confident that Nigerians will embrace these vaccines like we always do. Thank you.
Thank you.
Thank you, guys.
What's that?
Thank you, sir. Thank you.
Government officials don't accept the whole vaccine, and now they are pulling out of the airport.
BBC, you come late too.
You know, I've been here. See my boss.
Why don't see you?
My boss has been here. I've been here too.
And they talk, they say BBC people go come on and let them.
I did here. And one of the government people, they talk say, they know say BBC PG go call here, say they find me since they also are there. So we there, Coco every day, every time. Anyway they happen for Nigeria, anyway they happen for Africa, anyway they happen for the whole world we did. They show that things as they happen. We don't talk to some of the key government officials with the ground, including Dr. Faisal Shaibu, we don't talk to the NCDC, the director, and so many other people we follow come from to receive the vaccine, like we've been talking in the beginning. Now approximately 4 million vaccines now they received today for Abuja International Airport. And the government in the talk said then they plan to vaccinate approximately 16 million Nigerians in the next 2 years. But for now, the vaccines they don't receive just a little close to 4 million they received today for this place. They never really talk the exact time when they could begin the roll out these vaccines, but they say now very, very soon, according to the head of the NCDC. We also talked to the Dr. Faisal Shaibu, who will be the head of the Nigerian Primary Health Center. We say then they expect say by weekend the president and vice president, President Muhammad Buhari and Vice President Oshibajo, will collect the vaccine. So we'd expect that one to happen over the weekend. We're still there for the airport. Whenever they come out, we're still there for any other thing where they happen here. We want to see how they want to move these vaccines come out and where they carry them go. We don't know whether they go distribute them as they've been planned and has been talk. NPHCDA.
I didn't mention you.
right, for all our people who don't join us today. Now around here we go conclude the whole story about the arrival of the COVID-19 vaccine for Nigeria. The vaccine, what they call the AstraZeneca vaccine, we just arrived the country about a few hours ago. Government officials don't enter this international airport we there for Lagos to receive the vaccines, and as it be so, authorities for here don't begin to move whole vaccines into trucks where they go use carry them come over for here. Now around here we will conclude our broadcast for here today, but before that I go like make I give one a free brief more about everything we don't see for ground here today. The aircraft where they see for my back, so now he carried close to 4 million AstraZeneca COVID-19 vaccines enter this country from the COVAX facility, where facility authorities put in place to ensure that they help countries where no too money to like help vaccinate their own people. So far Nigeria follow for those countries, and Nigeria is the next country to receive COVID-19 vaccine for Africa after Ghana and Cote d'Ivoire, which just received their own. If you watch TV yesterday, you go don't see, even for our website, you go don't see when the president of Ghana be receiving the same live television. And we told you what they hear today. We do also hear say the president of Nigeria, President Muhammadu Buhari, and the Vice President Mr. Osibajo for the two people who go vaccinate by the weekend, and they look forward to vaccinate 2 of them by this weekend, according to Dr. Faiza Shoaibu, will be the head of the Nigeria Primary Health Center for Nigeria people, where they work on how to roll out these vaccines. So far the NCDC team will be the Nigerian Center for Disease Control never tell us the exact time when they will begin roll out these vaccines, but they say are very, very, very soon. But so far so good. The Coco be say these vaccines don't arrive, and as they talk now, they don't begin to move them out of this location to the exact location where it's supposed to be. So now around here we'll put off our around here we will conclude our broadcast today, as authorities don't begin to move people away from the airports. We did hail all of you who don't join us this morning for this whole broadcast into this afternoon, and we get other story about this COVID-19 vaccine, what they be all about, what they want to do, how they want to do them. Get images of things we don't happen for this airport today live for our website, for our Instagram, for our Twitter handle, for also our Facebook handle. You can see everything there. Then go our website, you go see full story about everything where they happen for this area. Other story about things where they happen about COVID-19 all over the world, and other story about things where no concern COVID-19 where they happen. All these ones now to call them where we carry the show now on to say we they always they here whenever they happen, wherever they happen. So we go still bring on more story today from other angles inside Nigeria. Mona no come up from our Facebook page. Mona they here always because we go they bring on a story as it they happen whenever it they happen. My name is Andrew Gift where they hell on I say thank you so much for joining us for this broadcast today. May God bless all of you now.